Cholesterol itself isn't bad. We all have and need this fat in the blood, but high cholesterol is one of the major risk factors leading to heart disease. As Dr. Richard Goldfarb tells us, a natural replacement for the usual statin regimen may be an important tool for management.
A large portion of the cholesterol issues in this country and worldwide happen to be from our genetics and is familial. What we really focus on, because we can't change our genetics, is we're focusing to decrease the amount of cholesterol that we take in our food, and then we also want to treat the circulating cholesterol that's in our body. If your cholesterol level is only slightly elevated above the normal range, physicians try to talk to their patients about changing their food intake into low-fat type of foods with the addition of exercise. It is noted that you should exercise between 3 and 4 times a week for about 40 minutes each period of time. Seems to be the best formula to treat cholesterol initially.
Dr. Goldfarb relates some surprising statistics on the effects of cholesterol.
Cholesterol is a major contributor of cardiovascular disease. In the U.S. alone, one person dies every 40 seconds from cardiovascular disease. Cardiovascular disease claims more lives each year than the combination of cancer, all types, and lower respiratory deaths. If cardiovascular disease was eliminated, the average life expectancy would rise about 7 years. The estimated cost to our healthcare system is about $316 billion a year.
Statins do control cholesterol, but there is an option that does not have the side effects of statins.
When cholesterol goes up, it is known that a group of medications known as statins has been the gold standard for years in lowering cholesterol. However, there's an awful lot of side effects associated with the statins. A lot of what we call myalgias, muscle aches. Also, your liver enzymes themselves have to be monitored. So for most people that either don't tolerate statins or want to lower the dose of statins to decrease those side effects, especially those terrible muscle aches, is that there is a product that was created several years ago by the inventor of Gatorade called Cholesterade. Dr. Cade, who invented this, actually did it because he suffered with what we call hypercholesterolemia, an increased level of cholesterol in his blood. He had been on statins and really suffered with those side effects to a great degree. So with this new formulation that he had come up with and then clinically studied, he was able to lower his overall cholesterol levels, decrease the amount of statins, and eventually got off the statins and took this product called Cholesterade.
Dr. Goldfarb describes how Cholesterade works.
What we suggest they do is to take it with each meal. This way, when they even take a fattier diet or have a fatty meal, and the Cholesterade is then taken right at that time, it's able to bind that exogenous cholesterol, and then it is eliminated through the GI system. Some of the other benefits are they're able to manage their weight. They've actually lost weight with this product. They've also had, which is amazing, is they've been able to normalize their blood pressure. They're feeling more energetic. There's just a whole myriad of different effects in a positive way that happen with Cholesterade, and we've not seen that with our prescription medications.
There have been advancements for the product.
Recently, the company had put together a new and improved formulation with the addition of what we call proenzymes, where the GI system would be able to tolerate it better, no irritation of the GI flora, and it also increases the transdermal delivery system of the product, so they're actually getting an additional benefit from the product itself. And we're seeing even lower levels and better results in a quicker period of time. In 4 to 6 weeks already, we've seen dramatic results in our patient study.
Improving one's health and replacing prescriptions with natural products may help towards lowering high cholesterol levels.
What Dr. Cade had created back in the time when he studied a natural remedy for an increased cholesterol issue in this world, which is absolutely just epidemic, is the fact that we're able to carry on his tradition. improving some of the ingredients to make them even last a bit longer. And we really feel like we have something dramatic that's going to really change the way cardiovascular disease is treated today with this problem of increased cholesterol in our blood.